Dermatology is a specialty that deals with how we fit into the environment. So the environment challenges us all the time. So the sun, the wind, the bacteria, the viruses, everything touches us, touches our skin. And dermatology is a medical specialty that relates to the environment. One thing that is interesting that I've been researching my whole medical life is the vulnerability that some people have to some pathogens. Look at Covid-19 through the lens of a dermatologist. We think of the host and what the person has that is different, that they interact in a different way to the pathogen. Our patients come to our office, we can see through their skin how their hormone levels are. Some people have pimples and also are getting bald or hair in the face. And we know that that's all driven by androgens, male hormones. The link there between the male hormones and the is that the cells produce a protease called TMPRSS2, which is a protease that primes the spikes of the virus, so the virus can actually infect the cells. Without this protease, the virus cannot infect any cells. So it is like the virus is bouncing in the surface of the cell without infecting. So this protease called TMPRSS2, it is only produced in our cells through male hormones, androgens. First article that we published about the possible link between androgens and COVID-19 in a clinical setting was a study we did in Madrid in a single hospital, and we analyzed all the men that were admitted in the hospital, and we looked at their scalp to see if they have had signs of excessive male hormone expression. An easy way to see if a man has excessive male hormones is just by looking at their scalp. When there's less density, less hair on the scalp, it means the person, through many years of their lives, they were exposed to male hormones in a way that they were actually very active in their body. The reason why we started to research this was that we saw that there was this link between male hormones and the infection, and we started to think maybe by controlling the male hormones we can protect. So in dermatology we control male hormones through many medications, especially the medications that we use for baldness, which are 5-alpha reductase inhibitors. After testosterone enters the cell changes testosterone into this other testosterone called dihydrotestosterone, DHT, which is much stronger than testosterone. Some people, they have more DHT activity. We see just by looking at their face that they have more DHT activity, but just by looking at their hair. If they are becoming bald, that means they have a lot of DHT activity. So the second study, it involved 3 hospitals in Madrid, and we started looking at all the men and women that were admitted for COVID-19, which was the peak of COVID-19 in Spain. To our surprise, not only men that were admitted to the hospital, they had higher frequency of baldness, but also the women. We looked at 175 patients, which 122 were men. We continued to see 79% of men admitted with diagnosis of baldness, and 42% of the females, they also had hair loss. There are many studies that are ongoing now that are using anti-androgens to try to protect people from the terrible outcomes of COVID-19.